So the other fascinating thing about these tyrosine kinase inhibitors, in particular Neratinib, which is one of the first of many kind of next-generation tyrosine kinase inhibitors after Lapatinib, is that they really do seem to have activity in HER2-positive metastatic disease. There was a trial, Neratinib, that was published in Lancet Oncology about 6 months ago, or almost a year ago now, where women with first-line metastatic HER2-positive breast cancer were randomized to paclitaxel and trastuzumab, or paclitaxel and Neratinib. And in fact, their progression-free survival was identical, which means initially, already, the drug is better. Neratinib is better than Lapatinib up front, because Lapatinib was not comparable to trastuzumab up front. But the fascinating thing about this trial is that the incidence of brain mets as a site of progression was dramatically reduced, I think probably from like 30% down to 10%, if I remember the data correctly. I'm kind of close to that. I can't really recall off the top of my head. But clearly it was a substantial reduction in the brain metastases. And given that, I think that's really interesting because the drug penetrates the CNS, and it seems to have activity, potentially as a single agent, because the paclitaxel doesn't get into the brain as far as we know. So this is really, really interesting data, because brain metastases seem to be the biggest problem, or one of the big problems right now, with women eventually dying of metastatic HER2-positive breast cancer. And if we can somehow push out the incidence or progression of those brain metastases a couple years, I think we've made another major advance. The other thing that's really cool about Neratinib is that there appears to be, now that we're doing genome sequencing, exome sequencing of tumors, either through the Garden assay, Foundation 1, or something else, we're finding a certain percentage of women with metastatic breast cancer that's HER2 negative tend to have activating mutations of HER2 in the tyrosine kinase domain of HER2, the HER2 protein, the internal tyrosine kinase domain. And clearly, because drugs like Neratinib in particular seem to be irreversible inactivators of this, they seem to have a lot of activity. And there's a number, we don't know the incidence. Some people claim it's about 1% to 2%. In terms of lobular cancer, it may be as high as 10%, if not higher, of these progressive metastatic patients. And therefore, we may have a drug that has activity. In fact, there's currently a clinical trial, a phase 2 clinical trial called Summit, where women with HER2 negative metastatic breast cancer who have a tyrosine kinase activating domain mutation are given Lapatinib, and in some cases Lapatinib with fulvestrant. And even women who had progressed on fulvestrant seem to actually respond to this combination therapy. So it's really, really interesting. And actually, it may be one of the, if this data does pan out, it may be one of the reasons potentially in the future that we may have to do some of these exome sequencing, next generation sequencing assays on women with progressive metastatic breast cancer. So I think these are really interesting things that have come out that are kind of on the side of kind of the big data, which is the data that's really going to, I think, lead to the approval by the FDA.